There was a day in October of 2011 where my life changed in an instant. It was the day that I was diagnosed with AML, leukemia. To this day, it's still very difficult for me to talk about because very traumatic situation going through it. Prior to that date, my life was very active. I used to go to the gym 4 or 5 days a week, spin classes 3-4 times a week. I lifted weights, very nutritionally oriented, did a lot of traveling. My businesses were very successful and had great ideas for wanting to continue to professionally just grow in my work. I've been going to spin, like I mentioned, and for some reason, all of a sudden, I just kept getting tireder and tireder. Where prior, I'd be able to get through a class, and I'd be very strong, and I'd feel like, you know, I accomplished a lot during the class, and then I started getting to I couldn't even finish the class, just exhaustion. So my girlfriend at the time, who's now my fiancée, Janine, suggested I go have a blood test, which I did. It came back that my white blood count was very low. The doctor said, well, maybe you have a slight infection, let's retest it. So I was retested, and sure enough, the white blood count came back even lower than that initial test. I was immediately referred to an oncologist who did further blood tests and other examinations, a bone marrow biopsy done. Results came back that I was diagnosed with AML leukemia, a very rapidly growing and very far advanced blood cancer. At the time, I just, you know, you're in denial and you don't realize, you know, what that means. I said to the doctor, do you think that I can try some alternative treatments to see if that would help before going into very aggressive chemotherapy? The doctor said to me that if I don't start chemotherapy immediately, I would not be alive in about 60 days. Within 24 hours, I was in the hospital having my first round of chemo. The first round of chemotherapy didn't work. Doctor came in and said, okay, we're going to change this, we're going to try something else. A second round of chemotherapy happened, and it didn't work. For those that have gone through chemo and gone through something like this, you realize that the chemo isn't the bad thing. It's the effects of the chemo in terms of when all of your blood counts and other counts, your immune system counts start to drop. That's when they start feeding you transfusions and other drugs and antibiotics until your white blood count and your immune system and other blood counts come back to normal. The doctor said to me, okay, we're going to give it one more try. And he says, I don't understand why that second round didn't work. I hit you with enough chemo to kill a horse. The third round of chemo, about halfway through, I developed pneumonia. And my temperature just went to the sky. I remember just being freezing, and doctors came in and expert consults, you know, came through, doctors that specialize in infectious disease and all. They wound up rolling me in for other kinds of tests. I don't remember about 3 weeks of that point in time. It was during that time where they called my children in from school. They didn't think that I would come through that experience. Well, for whatever reason, one day I opened my eyes and I said, what the heck is going on here? I had all these tubes in me, oxygen and all of this, and I was told that, you know, they've been hitting me with every possible antibiotic and antiviral that they had in order to help get rid of the infection, with the hope that my immune system would recover in time, you know, so I would be able to get better. Very traumatic experience, you know, going through that. The doctor also told me that, believe it or not, you're in remission. However, if you're going to survive, you're going to have to go through a stem cell transplant. And that incorporated finding a donor, looking for a donor that would match my genomics and have those genomics, those stem cells, transplanted into my body. I wound up at Moffitt Cancer Center in Tampa, in which I had a stem cell transplant. I was there for about 100 days. My sister turned out to be my match. Since that point in time, you go through, when you have this type of cancer, you go through a lot of different, I'd say, issues that occur. Everything from graft versus host disease, other infections, pneumonias. My immune system is still compromised, so I'm on Rapamune, which is to prevent the transplant from interacting or affecting my body, which can be worse than the cancer. So it's been a very interesting rehabilitation over the last 7 years, going through it. During this time, I was on all kinds of meds, steroids, drugs, antivirals, and couldn't seem to strengthen my immune system enough to get off of these other drugs. It was at that point in time that I started looking for alternatives, and cannabis was one area that I started looking at. Well, I met someone on Facebook that ran a Facebook group who just so happened to have had the same type of cancer I had, and he was able to not only cure himself but prevent it from reoccurring through use of cannabis oils. When Florida's law passed for us to be able to get medical licenses, I got my medical cannabis license, and I began to take medical cannabis as basically for me to, number one, from the treatments ongoing, I have chronic pain throughout all the joints of my body. It could be my neck, my shoulders, my hands, my hips, my knees, my feet, and a lot of inflammation that occurs with it. And what I have found is the cannabis oil that I take helps me reduce that pain. It was wonderful. Also, what I found with it is that my attitude improved. And I personally should stay away from vaping because I've had pneumonia 3 times. And I've got a lot of scar tissue in the lungs as a result of it. But for a lot of people, it's very effective. If you're using a dispensary oil and not an oil that you're trying to buy off the street where you don't know what the real ingredients of it are and you don't know if it was made in somebody's basement. If you're buying it from a dispensary, you know that it has been independently lab tested. You know that there's a quality assurance process every step from when they put it in the ground to when they grow it, to when they harvest it, to when they process it, and to when they bottle it. So you're going to see a consistency in those products as well over the long term. My suggestion is on a vape or on a vape pen, you're able to adjust the intensity of the smoke that you're able to pull out of the pen. There is a very light setting in which when you take a draw on it or take a hit on it, you don't feel like you're getting anything, and when you exhale you don't see any smoke, yet it has an effect. There are other settings that would give you more smoke, and that you may find much more damaging to the lungs. If you've got lung issues, if you've got a history of lung infections, pneumonias, lung cancers, you want to stay far away from smokable cannabis, and my suggestion would be to stick with the oils or topical patches that are transdermal that could be utilized. They say that here in the state of Florida, edibles are going to be legal at some point in the near future. I hope they are, where they are in other states, and that's another viable alternative to having to smoke, and it can be very, very effective. Can you overdose? I've been asked. I've never overdosed on any of the cannabis oils that I've taken. I can say that I may have taken too much, and for me, taking too much means is I feel that I'm high and not being able to be fully effective in what I'm doing. Some people want to get a cannabis license just to do that, and of course in recreational states, you know, people are purchasing cannabis products like they would, you know, go to a bar and have a beer or two or three. But from a medical standpoint, the worst thing that could happen is that you get a good night's sleep, or it wears off in about 3 hours, and you're able to go on with your day and learn from that experience. It's too much. Take less. To say that I was depressed, to say that I was experiencing, I guess you could call it a form of like what veterans get when they come back from service, post-traumatic stress syndrome. When I think back of a lot of the incidents that I was going through, it was very stressful. And I feel that, like even today, when I go into crowds of people, I have to be cautious. If somebody sneezes, I can't help but have a reaction to it, because that germ could cause me to basically have to go to the emergency room, because in 48 hours I'm running a fever. So what the cannabis did for me there was it really helped me not only for my pain and the inflammation that I had in my body, but it also helped my attitude. I was able to sleep better. I'm able to sleep better now than I was prior, where prior I was taking drugs to help me go to sleep. My overall outlook in life is shifted from being a victim of illness to one that is basically recognizing it for what it is, and to now feeling like I can go forward in life and be productive again. And I'm also finding the pain by far is much better managed than it was prior. I would recommend medical cannabis, whether it be in the form of CBD, THC, a combination of CBD and THC, to anyone that has gone through cancer, any type of trauma, anyone that has post-traumatic stress syndrome, anyone that has been having to deal with chronic pain and either want to eliminate whatever drugs you may be taking, or not have to take drugs and use this as a drug-free alternative. It's very, very effective. Now, I've been asked by a lot of people, how do I know what works and what doesn't work? And what I find is that medical cannabis, we're teaching ourselves, and our doctors and our support people are teaching us to self-medicate and self-regulate. It's not like you go to the physician and he says, take 3 of these 3 times a day and come back and see me in a week and we'll make adjustments then. We make our own adjustments. I know that I make my own adjustments by trying different products. And the way that I start with it is I take 2 drops to start, and I see what the effects are. I take them under the tongue and I just let it dissolve, and I see how I feel. If I see after 2 hours nothing's happening, I'll take 2 more drops. See how I feel. The next day I may take 3 drops and see how it works, till I titrate up to an area that I feel that I can be productive, I can be responsive, and I don't feel like I'm having to walk around stoned all day like some people perceive it to be. It really isn't meant to be that at all. So if you're going to a particular physician you want to make sure that that doctor is somewhat knowledgeable and their staff is knowledgeable, so they can help you in making that determination early on. As you go to the various dispensaries to check out certain products and certain items, in some dispensaries you'll find that the people there are very helpful and very knowledgeable, and some less knowledgeable. So you really have to begin to make your own determinations about it. Over the course of the last year, I have identified 3 or 4 different products that I use. One, I would say, during the day to help me deal with pain, but also to sort of act as a mood elevator, and also to act as a way to help me focus. From that standpoint, if I'm needing sleep and needing to use product for sleep, I have another oil that I use for that. And I usually wind up taking it about 2 to 3 hours before I plan to go to sleep. And that's when it not only kicks in, but it's operating at its maximum level, and then it affects and helps to get a good night's sleep.